Hey, welcome to Rightfocus Healthcare LLC educational channel. In our last video, we discussed about metformin combination medications. Today, in this video, we will discuss about a combination of SGLT2 inhibitors with DPP4 inhibitors, mainly Qtern and Glyxambi. So, which are the patients these medications are indicated? These medications are indicated for diabetic patients who need additional blood sugar control beyond metformin or who has metformin intolerance, and also we already discussed about metformin combination with SGLT to provide extra cardiovascular and renal protection benefits. So those patients who need that but at the same time cannot tolerate metformin. And also another one, the patients who need medications which are of less hypoglycemia risk. So with SGLT2 medications, it reduces glucose reabsorption by the kidney, so it's work independent of the insulin secretion, while also the same DPP4 make the incretin hormones release the insulin based on the dietary intake. So these are both independent of the insulin, so that way it's of less hypoglycemia risk both. And then this can be prescribed as when the metformin is contraindicated, like a low GFR, and there is severe GI intolerance like nausea, vomiting, diarrhea, and bloating. So in this video, other than the indications, we will learn about the dosages of DPP4 and SGLT2 combination medications, their benefits, their side effects, and the clinical considerations. So the most common and the popular combo of SGLT2 inhibitor and DPP4 inhibitor is Glyxambi. The components are empagliflozin, which is an SGLT2 inhibitor. Another name is Jardiance, plus linagliptin, which is a DPP4 inhibitor. Another name is Trajenda. So how do you remember the name? There is no easy way. So how do I remember? It's Gly for the gliptin. So it's a DPP4 combination. And then Glyxambi, it's a empagliflozin. It's some kind of similar pronunciation. And the dosage forms are 10 milligram empagliflozin, 5 milligram linagliptin, and 25 milligram empagliflozin, 5 milligram linagliptin. So you see that the linagliptin dosing doesn't change, and we don't have to adjust it for the renal dose. That's another advantage. And also we have to check the EGFR prior and monitor and the serum creatinine periodically and prior, contraindicated if EGFR is less than 30. Next combo of DPP4 inhibitor plus SGLT2 inhibitor, popularity wise, is Qtern. The components are dapagliflozin, which is an SGLT2 inhibitor. Another name is Farxiga, plus saxagliptin, which is a DPP4 inhibitor. Another name is Onglyza. The dosage forms are 5 mg dapagliflozin, 5 mg saxagliptin, and 10 mg of dapagliflozin, 5 mg of saxagliptin. You can see that the saxagliptin dose is the same, and it's contraindicated if the EGFR is less than 45, and we have to monitor the creatinine prior and during the treatment. And although the saxagliptin component in this Qtern has a risk of heart failure, dapagliflozin, the SGLT2 inhibitor, has a extensive clinical data for clinicians. So in comparison to other SGLT2 inhibitor like canagliflozin, which has a fracture risk and a risk of lower extremity amputation, this medication is more popular and widely used. And also when compared to another SGLT2 inhibitor, which I'm going to discuss in the next slide, ertugliflozin, that is the new medication. The combo of SGLT2 inhibitor and DPP4 inhibitor is teglucan. It's not popularly used, it's only emerging. The components are ertugliflozin, which is an SGLT2 inhibitor. Another name is Teglatro, and plus sitagliptin, which is a DPP4 inhibitor. Another name is Januvia. So you can remember easily the name Steglucan. The dosage forms are 5 milligram ertugliflozin, 100 milligram of sitagliptin, 15 milligram of ertugliflozin, and 100 milligram of sitagliptin. Just like other medications, we have to monitor the serum creatinine and contraindicated if EGFR is less than 30, and it has a side effect of lower extremity amputation risk and pancreatitis. Next, let us discuss the side effects of SGLT2 plus DPP4 combinations. Nasopharyngitis, arthralgia, sometimes severe, electrolyte changes, rare, and also the SGLT2 component can cause polyuria, and because of the reduced afterload, there will be hypotension, and because of the polyuria can lead to urinary tract infections, genital mycotic infections, and urethritis. Let us review the advantages of SGLT2 plus DPP4 combination, Qtern and Glyxambi. Blood sugar reduction by SGLT2 and DPP4 mechanism. What that means, it's the SGLT2 will prevent any blood sugar spikes, and while the DPP4 controls the blood sugar when we are eating food by controlling the incretin mechanism. So and then there is increased A1C reduction about 0.8 to 1.2 percentage. So this is metformin alone in higher doses can reduce A1C reduction up to 1.5 percentage. But what is the advantage of these medications? This is good for the patients who cannot tolerate metformin. And then there is lower risk of hypoglycemia, which we already discussed. And then weight neutral or modest weight loss. DPP4 is weight neutral, and then there is a weight loss help with the SGLT2 inhibitor. Cardiovascular and renal protection benefits, especially when the patients are intolerant to metformin, and then well tolerated with less GI intolerance like with GI symptoms. Then convenient once daily dosing only. Before I conclude, I want to say that the cost of these combo medications is around $533, which may impact the access to patients depending on their insurance and the coverage. I'm concluding this video here. Today we discussed the combination medication SGLT2 inhibitor and DPP4 inhibitor, especially the common ones Qtern and Glyxambi, their dosages, their side effects, and their advantages, especially the blood sugar reduction by SGLT2 and DPP4 mechanism. And there are other advantages: increased A1C reduction, low risk of hypoglycemia, weight neutral or modest weight loss, and for the patients who are intolerant to metformin, these medications provide cardiovascular and renal protection. I hope any nurse practitioners or any other providers listening to this video got some new information. If you like the content, please subscribe to the channel. Thank you for watching.